in a graphical sense that when people don't listen and don't enroll in your care plans, it really represents lost revenue to your practice. And that's what this slide represents here. Like every person that comes into your practice represents revenue. And when they don't follow you and they don't listen and they don't enroll, that is lost revenue to the practice. I think it's pretty obvious, but I just want to kind of nail that down, that you realize that that's the case. So when your CA is on the phone and they fail to get that person to make their appointment, or they make it easy for people to miss appointments, that type of thing, and not follow the treatment plan, that becomes a real challenge. In fact, what we find is that your patient compliance, your patient's following through, the reason we're talking about care planning here is because it's significantly impacted on how you care plan, as well as how easy you make it for people to pay you. That if you don't do these two things really well, you are setting your patient up for failure. You're literally setting them up to prematurely self-dismiss, to not follow your treatment plan, maybe to exit when they're feeling better at that stage of care when you know they need care beyond that, whether it be a corrective program or a maintenance program, you know they would benefit from it, yet they suddenly disappear because the pain went away, or they disappear because their insurance is exhausted. If you care plan correctly and you make your payment model done correctly, you will eliminate that. In fact, what we'll see is that practices that do this, they no longer suffer from people dropping out of care simply because their symptoms went away or because their insurance was exhausted. I'm going to briefly show this to you. I'm not going to take too much time on this, but this, if you want to take a screen capture of this, please do so. This is simply just showing you a chart showing, not a chart, but a matrix going from the bottom up, no care planning at the bottom, which is basically see a person one visit at a time, to a care plan that's just exam to exam versus a full comprehensive care plan going from the bottom up. Obviously, when you go from the bottom up to the top is the most comprehensive care plan you can do with a person. And then the different ways you can collect payments for those things, whether it be a per visit model, whether it be people prepaying, whether it be people making a monthly payment. What you see on the right is the retention. PVA is a common way we look at retention. And what we see is this matrix will show you what you should expect in your patient retention associated with that, as well as a translated lifetime value of that patient. Obviously, the longer someone stays with you, the longer they follow through and complete your treatment plans, obviously they bring in more revenue, they have a greater lifetime value in that practice. That's strictly what this is to illustrate here, is that the way you structure your care planning, the way you structure your collections will greatly impact your patient visit average. In fact, I can hear a doctor talk and tell me about the way they care plan and the way they collect money, and it's pretty predictable what their PVA is, regardless of the other things they're doing in the practice about patient education, all the other things they do to build retention and build patient follow through. That stuff really doesn't have much impact relative to whether they're care planning or the way they're making their payments.